Hey, good morning to you. This is Dr. Olmschner at the Ozark Chiropractic Clinic, and here again for our next email installment. We're going to continue on talking about functional medicine. I just want to explain more what's going on and what we're doing there and such. If you can remember, we talked a little about liver function the last time and how it's a good basis to start with. There's a little an acronym that we use called bail 'em out, and it stands for B is for blood sugar regulation, which we'll get that important there to get that in line. A is for anemia, checking anemias, because that affects obviously your energy levels, your oxygen levels. Then we got two I's. We got inflammation and infection. So a lot of times there's chronic underlying infection that patients have. They don't know it because it's been in the body so long that the body's adapted to it and it really doesn't fight it anymore, but it does affect how your body works and creates inflammation and other problems. And then you deal with the inflammatory state that can occur when all the other processes get out of whack. And then there's liver and gut. And that's very important because you've got to make sure your gut is functioning properly. Research is coming out all the time. It's something that we've known for a long time, the connection between the nervous system and the gut, and that how important it is to make sure that it's working properly. You know, if your gut's not working well, it's going to affect a lot of other things in our body. And most people do have issues with the stomach. So that's something that we want to make sure is working well. So we use your blood work to help figure out what's going on. And talking about blood work, we talked about, when you get results back from the doctor and they look at them and go, hey, everything looks great, you're in range. Okay, well, that's fine. Clinical range is different than what we call ideal ranges or homeostatic ranges. You know, you could be at the end of the clinical range and still be within your normals, but your body's not functioning as well as it should. There's patterns that'll show up when you look at blood work too. You know, like if this is off and this is off, this could indicate that. If this is off, this, etc., that kind of thing. So it's very important to look at and not just accept it as, okay, you're within range, you're good. Because remember, the ranges are set over a wide group of people. Not everybody's the same. We're not all the same. We don't react the same. So it's important to individualize it for you and to make sure that there's something that's not being missed that can be taken care of efficiently. And so again, using the lab work. We're still in limbo there. We've had some personnel changes, unfortunately, a lot, so we don't anybody can do the blood work right now. So we're still gonna working with the lab, see what can be done there. And then also we can always use the lab work that you have from your doctors. That's always fine, and so that's not an issue there. So bring it in, we can work with it from there and just help you out that way too. So don't let that stop you, so that's good to go. Little tip to look for today is what we call reactive hypoglycemia and stuff. Let me grab my little notes here and such. Think about you if you have these symptoms, because a lot of times we talk about patients who have, increased blood sugar problems, diabetes, okay? That's more common. But a lot of times there's folks out there suffering what we call reactive hypoglycemia, meaning your blood sugar's too low and stuff. So if you're seeing symptoms like, do you crave sweets during the day? Are you irritable if your meals are missed, okay? Do you depend on coffee to get you up and keep you going? Do you get lightheaded if your meals are missed and things? Eating, does it relieve fatigue and things? Do you feel shaky, jittery, tremors, that kind of thing if you're missing meals and stuff? Do you get agitated, upset easily? Do you have poor memory, forgetfulness, or brain fog, even blurred vision? These are signs of reactive hypoglycemia. So we always still want to work with the liver and taking care of that, but we're going to change how you eat a little bit more. You're going to have a few more snacks during the day to keep your blood sugar up, and you're going to change what you eat. Always make sure when you snack with anything, make sure it's a protein or more of a fat-based nutrient. You don't want to have sugar, obviously, because that's just going to spike the problems and you just keep going on and on what you're doing. So look at, if you have those symptoms, that's something to talk to me about. Let's see what we can do to help you. If that's you, say, hey, I got that going on. Let's help. We can work this out and we can help you. But I want to thank you for your time today. I appreciate you always. Check us out on the Facebook site. Like us there. Also, we've got our Patient Appreciation Week coming up next week. All week, any new patient will get their exam or x-rays at no charge. So that's a golden opportunity. If somebody out there you know is having issues, you want to help them, tell them about it, send them in. And then for our regular patients, we're going to have a drawing. If you refer somebody in, we'll put 3 tickets in the drawing. If you like us on Facebook or write a review on Google, we'll give you 2 tickets. Make your office visit that week. You get a ticket in the pot, and we're going to give away a cervical pillow and a massage. So something for you guys. I think you deserve it, and I appreciate you always. But thank you for your time. As always, we're here for you. Call us anytime, 667-5053. Have a great day. Thank you.